Projections by epidemiologists now indicate an upward trajectory in the wake of the ongoing COVID-19 pandemic. The Director of Public Health, Dr. Patrick Mauthun-Mande, said, according to the prepositioning module, Kenya will more likely record at least 1,000 cases by end of next week and then double or triple within the month of April.
This virus is not following a particular trend. Our modeling puts us at having about 1,000 cases by the first week of April, and we postulate that we'll have 5,000 cases by mid-April and potentially 10,000 cases by 30th of April. So those are the figures that we are working with in terms of how we preposition our personal protective equipment, how we preposition our test kits, how we preposition our human resource, and how we preposition our isolation and quarantine facilities.
Dr. Mauth says this rise will be compounded by a number of factors, including the high burden of communicable diseases in the country, especially HIV/AIDS.
What may work against us, of course, is our weak health system, and of course, our disease burden, especially HIV. Especially when we have community transmission as confirmed by Waziri, then especially those who are not adherent to the medicines would have lack of viral suppression, therefore could be at risk.
Currently, there are 1.3 million adults and approximately 139,000 children living with HIV in the country. Statistics by the Kenya Population-Based HIV Impact Assessment (KENFIA) indicates that of those diagnosed with HIV, only 96% are on antiretroviral therapy (ART). It further indicates that only 71.6% of adults and 48.3% of children living with HIV in the country have achieved viral load suppression. However, on a positive side, the government says the country's youthful population, which comprises of 75% of the 47.6 million people as per the 2019 census report, will play a major role in flattening this curve.
So potentially it is possible that our people will be able to catch the virus, but probably just pass on as a mild illness.
And in a bid to capture more cases, the government says plans are underway to increase the country's testing capacity.
We have agreed in consultation with our technical team that we are only going to test those who are in quarantine after the 8th day. But remember also, the laboratory capacity that we have, we can only do 300 samples in 24 hours. We are working very hard to ensure that Moi Teaching Referral Hospital comes up in the course of this week to be able to provide additional testing capacity.
Gloria Milimu, K24, Evening Edition.